In this exercise video, we're going to show you how to work on internal and external rotation at the knee joint to help maintain good ability for the knee to fully flex and extend and accommodate any twisting motion with daily activities. So it's a very important type of motion that we need at the knee, but often is very much overlooked. So what I want you to do is get yourself sitting on the edge of a chair and bringing your knee so it's in a 90-degree bend and your ankle is directly underneath your knee joint. In this position, the knee should have a lot of ability to rotate inwards and outwards. Now, if you're on tile or hardwood floors, you want to get a towel underneath your foot so it can easily move around. Or if you're on carpet, it's a little bit tougher, but you can get one of the little sliding discs that you use for exercise, or a paper plate will work really well on carpet. So get yourself in this position, and what you're going to start off by doing is one foot is going to be on top of your towel or paper plate or whatever you're using, and you're going to use your hands to help kind of hold your knee in position, because we don't want the knee to wiggle around inwards and outwards. We want it to stay centered right over top of your ankle. In this position, with holding your knee steady, you're going to slowly try to rotate your foot out to the side and then come back to the center. This is what we call tibial external rotation. And so you can see my foot is turning, but my knee is staying straight, and I'm getting a good amount of motion into that external rotation. And you're just gently going as far as you can without being too aggressive, pausing for a brief moment, and then coming back to neutral. So again, that's the external rotation. We need this ability to externally rotate to be able to fully extend the knee straight. So if you're having a really hard time regaining those last few degrees of knee extension motion, working on that external rotation of the tibia is really valuable. Now for the internal rotation, we're going to be rotating the foot inwards. So again, hold that knee steady, rotate the toes towards the other one, the opposite foot. And you can see my knee is staying straight, and I'm getting those toes to rotate inwards. All this motion is happening at this knee joint, and your foot should be staying flat on the ground. So rotate inwards as far as you can comfortably, hold for a few seconds, and then rotate back to neutral. Again, this is tibial internal rotation, and this is really valuable for regaining knee flexion. So if you're having a hard time regaining those last few degrees of knee flexion, working on this internal rotation ability can be very valuable. One thing to note as you're doing this exercise is, again, make sure the knee is staying steady, because I don't want it to look like this. But the other thing is to make sure the foot stays flat on the ground. So I don't want your ankle to do the motion like this. There should be no wiggling around like that. Your foot should be staying flat on the ground and very rested and neutral. And you want to be pivoting around your heel. So I'm just gently pushing down through my heel and moving more through the front of my foot, because I don't want it to look like this. You're not doing like a Dorothy thing from The Wizard of Oz. You're doing more of like a windshield wiper with your heel staying planted and the front of your foot doing the motion inwards and outwards. So a couple things to keep a note of and to gently work on that. Now, once you start working on it, what you can also do is help encourage the muscles to keep this motion. So after you've been working on getting the motion to improve and getting more range, then what you can do is rotate out and then very gently try to push with your big toe into the ground, and then gently push with your pinky side into the ground. Big toe into the ground, hold for 3 to 5 seconds, pinky into the ground, 3 to 5 seconds. Big toe into the ground, 3 to 5 seconds, pinky into the ground, 3 to 5 seconds. Relatively trying to keep this knee steady, so I don't want it to look like this. When you're pushing through the big toe, you should feel some activation on the inner hamstring area and a little bit through the lower calf. When you're pushing through your pinky side, you should feel maybe a little bit more on the outside of the calf and the outside of your hamstring. So this is encouraging the muscles to keep that motion. If you're going that way, external rotation, you're going to do at the end range of that motion there with big toe pushing, pinky pushing. If you're doing internal rotation, it's the same thing, big toe pushing, pinky pushing, and working on getting the muscles to activate to hold that motion. So work on this after doing your stretching and mobility work and see if that helps improve your range of motion.